Hi, Dr. Smith. This is Melissa from the emergency department. We received a 22-year-old male who was involved in a motor vehicle rollover. EMS was on scene for approximately 20 minutes extracting the patient prior to arrival. The patient's vitals en route were a blood pressure of 105/72, respirations at 18 per minute, and O2 sats sitting at 98% on a non-rebreather. Upon arrival, the GCS was completed and a score of 7 was determined. The patient is currently intubated with O2 sats at 97%. A second IV site was inserted and 30 milligrams of tomidate and 120 milligrams of succinylcholine were administered through IV push. The patient has seen a 4 centimeter laceration to his forehead and a 5 centimeter laceration to his right cheek. A piece of glass is sticking out of the patient's right side of his chest. He has an obvious fracture to his right femur with abrasions to the right knee and shin. An open fracture with an exposed tendon is visible on the posterior aspect of his right hand and multiple abrasions on his left hand as well. There are abrasions noted on the right side of the patient's flank. Patient's vitals are currently sitting at an auxiliary temperature of 36.8, O2 sats at 97%, a heart rate of 120 beats per minute, and a blood pressure at 100/82. This patient is not hypotensive. My concerns for this patient are the trauma to his head, the visible fracture to his femur, and low blood pressure, which may be associated with severe injury that may require surgical treatment. For this patient, I would like to suggest an MRI to detect any brain injury that may not have shown on the CT scan prior. I would also recommend that X-rays be done to his right femur and posterior right hand. Analgesics would be beneficial to help control any pain that the patient may have, and that a Foley catheter and an OJ tube be inserted as soon as possible. In the meantime, is there anything that I could do to assist you?